So yeah, so again, when we talk about hallucinations, they are perceptions, they're experience, sensory experiences. No? So usually ang ano sina, because you also need to be able to differentiate hallucination from inang internal self-talk. Kaya diba, for example, when you were talking about mga negative yung thoughts in your mind, like for example, ganun ba, mga wala kuya pulos, those things are internal. So meaning the voice inside your head. Pero when it's something that you can sense, like especially through your ears, somebody tells you, "Ay kaya pulos, law ay ka bundol ka." And it's something may araya sang sensation sa may ear mo dapit, like somebody whispering to you. So when you feel na there is a sound coming from outside, that is a hallucination. No, so ang ano na is you ask the person, the client, like ano na siya, like anong kayo hambal dabi siya nga waay ko kuno pulos, waay ko hambal ni sino, di ba? So meaning may external nga sound, may external nga source siya supposedly. Okay, so again, it's all senses ang involved sina, no? But the most common are auditory hallucinations. Now take note, we should not be very quick to judge all sensory experiences that are, weird as hallucinations. Because there are times when, for example, if very religious ang person, and then they say, nga, like, this is especially pag very down, gid bala ang person, nga mahambal sila dason nga, when I woke up the other day, nagpakita, like let's say si Virgin Mary sa akon, or nagpakita si Jesus sa akon, diba? Or naghulag ang picture ni Jesus, ginabot niya yakamot sa akon. So, diba, if you think about it, no? But since this is part of, diba, miracles are part of aton cultural belief system, we tend to not classify that outright as a hallucination. No, instead, it's just part of a cultural belief system. See? So yeah, so sometimes you'll have you'll see nga mga may angel, may bright light na nag-appear in front of me. I saw an angel. So we don't say it's hallucinate ka lang. The same way man also with ghosts. Like for example, if someone in your family, for example, passed away, sometimes people will say, nakita ko sa sang bintana nag-agi dali lang gid si Moni, nagalantaw siya di sa sulod. So we don't say hallucinate na si tita or si tito, no, kay patay na iya nga, let's say puya, no, we accept that as part of grieving, as part of the cultural belief system. Usually the spirit of the person who passed away sometimes does return to visit iyang loved ones, especially during the 40 days, 'di ba? May mga muna kita. Or sometimes pag araw ng mga enang sa November 1 and 2, All Saints Day, All Souls Day. So sometimes we say, 'di ba, we put a candle outside the door kay ang belief is nga during those days, pwede mag-visit sa imo-imo nga loved one nga napatay. So may muna kita. So we don't consider them hallucinations. Okay? Now, another one would be disorganized thinking or speech. So here usually, so it's really the thought process and the content that we're looking at. But diba, since hindi mo man makita kung ano ka-organized or disorganized, ang thought mismo, we rely on speech. So this is basically where nagahimo sila ya words nga hindi tuod, or kung kaistorya mo ga-jump from one topic to another, or inang gahinambal sila pero ga-rhyme lang ila ginhambal, wala sense. Basically, it's when you're talking to somebody and wala ya sense ang iya hinambal, basta lang gahambal-hambal. So that is disorganized thinking. Okay? And the other one, atong gin-discuss na naman in detail, kagina, negative symptoms. Take note, again, it does not mean nga kay ari siya under schizophrenia spectrum, hindi nga mga symptoms, dire lang gato nga. These symptoms, ang positive kag ang negative, show up in many psychological disorders. Especially, for example, ang negative symptoms, ining diminished emotional expression or blunt or flat affect. Tanan gid ni sila actually, they are very present in mood disorders, particularly depression. Diba? They may also be present in things like pag may ara ka sang substance use, diba? May, as in, ara man na sila, they're present in some other disorders. So we don't ever think na they are isolated in this family of disorders. Okay? So take note, remember lang, if it's a negative symptom, it means someone without the disorder experiences these things, but someone with the disorder nadudula ini nga mga bagay. So nadudula ang volition, alogia, diminished speech output. So meaning wala sila masyado gahambal. Anhedonia, wala sila ga-enjoy, ga-experience pleasure. Asociality, wala sila masyado ga-interact with people. Okay? And then there's also the category of abnormal motor behaviors. So when you say, for example, when you say, for example, nga catatonia or catatonic behavior, you have all these possible things. So in some people, stay sila, like, gapungko sila or gahigda sila in a particular position for a very long time. And then for some people naman, inang gaus-os, pumpupukoon mo sila sa chair, gaus-os lang sila yung gaus-os. No? Or sometimes, they repeatedly do things. So for example, hand flapping sila. Ila nga kamot, flap sa kilid nila. Okay? Or sometimes sumay-sumayon kanila. So kung ano ginahambal mo, liwat-liwaton man nila in front of you. Abi mo ginadaskalan ka lang. Pero it's really a psychomotor symptom. No? So those are some of the symptoms, catatonic symptoms, but they're not as important as the others that we have described. Okay, so far, are we good with the symptoms? Peopleettes, are you okay?
Yes, ma'am. Yes, ma'am.
Okay. So we remember that when we say schizophrenia spectrum, we're talking about the rainbow. And if you notice, this rainbow, wala siya sang clear nga pag-change sang color. Nga hindi siya yung black, box nga separate. 'Di ba? Where is the, kumbaga, ang delineation sang difference from one color to another, hindi siya gulpi. The same way, now, people with schizophrenia spectrum, people with different disorders under the spectrum, they will vary in presentation slightly. So, hindi mo na mahambal nga amugid ni uniform dapat ang natatabo sa one patient versus the other. And usually, may ara na isang, ang variation nila when we describe it is in terms of how much ang split nila from reality, how much ang distortion from reality. And these are the specific disorders under that family. Okay? Take note sa may blue nga parts, di ba? Kung delusions lang ang na-experience ang tao, wala siya hallucinations, wala man siya sang negative symptoms, wala man siya sang catatonia, delusions lang yan, that's a delusional disorder so at one end. And then, if it's not it's not extreme gid, but it interferes with all aspects of iyang daily living and interactions with other people, it's schizotypal personality disorder. But technically, wala siya gina-classify under schizophrenia spectrum. Gina-discuss gid siya sa personality disorders nga category. Okay? And then we also have to consider how long do the psychotic symptoms appear. So kung short lang, we call it a brief psychotic disorder. And then kung di naman niya masundan, then it's a brief psychotic disorder. If it's less than 6 months, ang pag-manifest ng iyang symptoms, we call it schizophreniform disorder. Diba? Pero if nakalapaw na siya 6 months, it becomes schizophrenia. Or if may kadungan siya ng mood disturbances. So for example, bigla siya may time na hyper gid siya or may time na very depressed siya, we consider it a schizoaffective disorder. Okay? So yeah. So this is taken from your DSM. So again, always consult your DSM because that's where you see pila ka symptoms ang kinanglan, how long dapat gatunga, 'di ba? And ano ang dapat kaupod niya, and anong i-rule out mo danay before siya mahambal nga this or that sakit. Okay? So we have to remember that schizophrenia is considered a disorder of exclusion. So meaning, i-rule out mo danay ang damo-damo. So mayroon kita sang ginatawag nga gina-rule in kag gina-rule out nga disorders. Ano na siya ang for those of you nga may mga plano da magdoktor. So sino din diri sa inyo may plano magdoktor after psych, mag med school? Waay?
Pasyente, guro mamaya.
May plano magpasyente. Pwede. Okay, we will take care of you. No? Pero na. So, I know. Pero anyway, it's important also to differentiate ang rule in versus ang rule out. As in ruler, bala. Pero anyway, when we do case conceptualization during the assessment phase, we gather as much information about the client. So when we have the information, we look at ano ang possible nga mga disorders nga may ari isang muni nga mga symptoms. And then amat-amaton mo dason. So for example, ano dabi is nagatake ini siya bala substance, may bulong ni siya bala nga ginainom that might be causing ang iyang hallucinations. Pag makita man niya sa patient history, nga wala man siya bulong, wala man siya maintenance, wala man siya nag-take sa anything prior to ang iyang pag-hallucinate, then what we do is we rule out ang substance-induced nga psychotic nga disorder. So, okay, hindi man niya gali tungod sa bulong ang pagkakaroon niya sang psychotic nga episode. So, gina-rule out siya. So, meaning, okay, hindi na siya dala sa possible nga sakit niya. Let's look at other things naman. So, amo na siya, ha? So, that's, ang schizophrenia is a disorder of exclusion. So, meaning, i-rule out mo danay ang all other possible disorders before ka mag-label sa somebody nga may schiz. Especially because grabe makapa-stigmatize ang label nga schiz. So people don't declare nga, may schiz ko, that's why gamuni ako. Diba? Kaya very often, grabe ang negative reaction sa mga tao about it. No? So, how do we end up with the diagnosis of schiz? So, dapat pila ka symptoms, 2 or more. So, minimum of 2. And dapat, ang isa sa duwa should be either a delusion, a hallucination, or disorganized speech. Okay? So, for example, what if ang nai-experience ng tao is catatonic behavior and negative symptoms? Did we fulfill ang criterion A? Guys? Ang symptoms ng person is catatonic behavior and negative symptom. Did we fulfill criterion A?
No. No, ma'am.
No, 'di ba? Because hambal sa criterion A, 2 or more tuod, so minimum of 2, pero dapat ang isa dira sa duwa should be a hallucination, a delusion, or disorganized speech. Okay? So sa dira pa lang, waay na. Pero let's say, for example, fine, ang isa is may hallucination siya, and then may negative symptoms. Then, sulod imo nga criterion A. Okay, so you go dason to criterion B. the level of functioning in one or more major areas is below the level achieved prior to the onset. Okay? So, ang ano sina is, before, okay man siya, nakakaklaro man siya mag-istorya, okay man siya, wala man siya sang ginahimo, nga out of turn nga, mga bagay-bagay. Pero now, hindi siya yaka-function as well as before. Sang waay siya hallucinations kag negative symptoms. Then, swak, ikaw sulod ko sa criterion B. Okay? And then, look at criterion C, dason. There is disturbance that persists for at least 6 months. So, it should be 6 months. Okay? And dapat may ara ka sang at least 1 month nga ang symptoms nga meet ang criterion A. So, meaning may active phase siya. Okay? And may ara man sang, pwede may ara sang time nga negative symptoms lang. No? Or, and then slight lang, medyo mahina lang a version of ang criterion A ang present, such as may mga hallucinations, delusions. So, again, ang key dira is dapat 6 months or more. Dapat iya functioning na i-impair. And dapat may sang 2 or more present for a significant portion during a 1-month period. So, meaning sa isa ka bulan, more days gidya. Okay? Majority of days gidya, may gatunga gidya nga ga-hallucinate siya, may disorganized speech, may delusions, may either may negative symptoms or catatonic behavior. No? And basically, dapat na-rule out mo ang schizoaffective disorder. So, meaning waay siya sang do mood disturbances, and then wala siya sang depressive bipolar disorder. Na-rule out mo na siya. Okay? So, wala sang mood alterations that might be causing these things. Kaya pwede na, kung may extreme kasi ka mood changes ikaw, pwede ka nga nagkakaroon ka sang hallucinations and delusions. And nagiging disorganized man imo speech. Pero ang lantawon dira, ang pag-hallucinate mo bala, pag-disorganize mo speech, is it because of the mood change? If it's because of the moods, extreme nga moods, it's not schizophrenia. It's a mood disorder or it's a schizoaffective disorder. Pero if there is no mood component, no, then that's more likely schizophrenia. And then again, you also have to rule out substance or another medical condition. And then you also have to consider autism or communication disorder because, like for example, sa disorganized speech, mambal kadabi nga lain-lain iya ginahinambal. Base iya kay tungod nga may impairment siya sa language. 'Di ba? So sang bata siya hindi gid man niya organized ang iya nga speech kay may speech impairment. Siya gani. So it's not because of schizophrenia ang iya nga disorganized speech. Okay? So, yeah. So, mangita ka dason sang lain nga symptoms to check. Kaya hindi mo ya pwede madala ang iya disorganized speech kaya may language disorder siya. Okay? And then you also have to specify dason. Did it appear suddenly? Diba? Is it partially gaayo-ayo na ang condition at the time na gin-assess mo? Is it in wala siya active nga, not in an active phase subong? And then, ano pa gid ang specifiers mo? So, usually may mga muna kang idugang dason. So far, clear ang diagnostic criteria. Guys, okay lang? You don't need to memorize everything, ha? But the main gid sini is usually ang category, ang criterion A, you need to know ano nga symptoms ang main nga pangitaon gid because usually sa category criterion A gid na siya ginabutang. And then usually lantawon mo man how long dapat, so ang time element because different disorders ang tawag depending also on how long naga-manifest siya. Now, in the previous version of the DSM, may categorization pagid na sila sang type of schizophrenia. So, depending on kung ano ang dominant nga symptoms. Now, take note, sa fifth version, wala na siya ginbutangan sang categorization because the psychologists and psychiatrists recognized na ga-change siya through time and sometimes gadululungan man niya ang expression sang mga symptoms nga ini. So the idea is hindi na lang gid pagbutakan sang categorization. No, if you label it schizophrenia, then it's schizophrenia, and then you just write down ano ang mga symptoms na gina-display sa person. But for the purposes of you just getting to know ano ang previous categorization, tumayara siya sang paranoid schizophrenia. So usually ang element nga dominant gid would be delusions of persecution and grandeur and then certain hallucinations. So the predominant theme is nga people are out to get him or her. And then may disorganized skits. So dira naman is usually ilang emotions is inappropriate for the situation. So for example, if they're talking about somebody who died and nagapinatawa sila todo-todo, or for example, like let's say ining ga huba-huba sila in public, nagasaot-saot sila, and then kung ano-ano ilagay na hinambal, so that's disorganized. And then if predominantly it's really more wala gahulag or mayara asang excited nga movements nga like repeated, may pattern movements, so catatonic skits. And then for example, if previously may active face siya, pero at the moment of your assessment, it's ano na siya, though mostly negative symptoms na lang ang gatunga, like blunted affect, no? Less na ya ang ining mga positive symptoms, we classify that as residual subtype. And then kung hindi clear kung ano gidya, then that's when we call it undifferentiated nga subtype of schizophrenia. Again, today we don't use those classifications na. This is just for information purposes. Okay? So here you will see the other psychotic disorders. I mentioned this na before. I again look at ano ang characteristic nga main sa nga disorder. How long siya dapat gatunga. Okay? And ano ang kinanglan mo i-rule out before ka maka-consider sa iyang disorder. Okay? Question so far?
None, ma'am.
Okay. Na, feeling ko mamemurpek ka mo sa inyong exam, no?
Ma'am,
Yes, Bri.
may question ko gali sa to, ma'am. Nang,
Oh, sige.
kay, di ba, ma'am, nagsala ko sa quiz dra, ma'am, dra, sa side ato ang atong 1 and 2 months. Why, ma'am, ano, ma'am, ang catatonic hallucination kag delusion ka, ma'am, ang answer, ma'am.
Dali lang. Ano na ito gani nga item? Ano ganito nga question?
Ato,
Wala ni ano ni Dabi, guys, lain-lain ang numbering depende sa kung sinong ga-answer. So wala ni fixed nga numbering. Day mo nga sala, Bri, ang first nga part ng sentence.
ma'am,
Anong first part ng
nagduwa-duwa,
sentence
kay
sa
kuya,
sala mo,
ma'am,
Bri?
ato ang nagduwa-duwa ko, ma'am, sa disorganized kag sa catatonic.
Sa ining kay Inday? Was it kay Inday?
Inday ato. Atong
Bibi. Vision o.
1 and 2 months.
In making a diagnosis of schizophrenia, and making a diagnosis of schizophrenia. Okay. In making a diagnosis of schizophrenia, sige, i-flash ko ha. Dali lang. Stop presenting. Share. At tab. Mhm. None. So can you see ang screen? Okay. So in making a
Yes, ma'am.
diagnosis of schizophrenia, at least one of the two symptoms that must be present for a significant period in a month should include either, 'di ba? Sa diagnostic criteria ni siya, before you can say schizophrenia, if you're going to say it's schizophrenia, there are a minimum of two, 'di ba? Two or more symptoms under criterion A should be present for a significant period, a majority of the time in 1 month. Dapat ang isa sa ila should be ano, 'di ba? So sa first choice, delusion, hallucination, or catatonic behavior. Kamo ina, ara ang delusion, yes, ara ang hallucination, but hindi kinanglan ang catatonic behavior, 'di ba? Next, hallucination, negative symptom, or delusion. Ara na naman ang hallucination, ara na naman ang delusion, pero ang negative symptom is not one of the priority na requirements give. So, no. Next is negative symptoms, disorganized thinking, or delusion. So, ara ang disorganized thinking, ara man ang delusion, but ang negative symptom is not required. 'Di ba? So, the last one, disorganized thinking, delusion, and hallucination. Sila ang top 3 priorities na ginalantaw. One of your two symptoms should be any of those 3. Okay? So, that is the answer. Klaro siya, Bri?
Clear na, ma'am. Clear. Thank
Okay.
you, ma'am.
So, always review ang inyong diagnostic na criteria. Iparbalaan nyo ano ang prioritization ng symptom nga pangitaon nyo. Okay, so again, one of the things you need to rule out is substance or medication induced or psychotic disorder due to another medical condition. Okay? So now let's look at ano ang mga ginahinalaan nga reasons nga man nagkaka-schizophrenia ang mga tao or any psychotic disorder for that matter. So first, let's look at epidemiology. How common is schiz? Is schiz common? Would you say schiz is common?
Yes, ma'am.
Yes, it occurs in 1%, about 1% in the population. Meaning, out of 100 people, how many would have schizophrenia?
1.
1, di ba? 1 in 100 people. And that's quite a lot, di ba? That's quite a dako ang to consider it. Di ba? And it's common in all cultures and across all socioeconomic groups. So hindi mo siya mahambal nga it's more common for the poor or the rich or the super rich. It occurs across all economic groups. And mas common siya sa kay sino? Lalaki, babae.
Babae, ma'am.
Mas common din kay sino? Lalaki, babae.
Lalaki.
It's more common it's twice as likely to show up in men versus women, diba? 2:1, no? But there are distinct differences. So when people show up when people present with symptoms of schizophrenia, we look at part the history taking would be kung ano siya, pila ka tuig siya. So for adults, for males, one of the common ang prodromal symptoms niya, ang time bala nga gaamat-amat show up ang mga symptoms is during adolescence. No? So teenage years, no? And nagatunga usually. So that's why common na nakikita mo ang paglalaki gani may first sign siya of a psychotic disorder occurs during senior high school, college, or first few years gaga-work siya. Okay? Versus ang babae tends to appear later. So usually may trabaho na siya or may pamilya na siya. And then in terms of symptom, medyo mas common sa babae ang positive symptoms, may hallucinate. Versus sa lalaki, it's really more daw ga-shutdown siya emotionally and behaviorally. Wala ga take care sa ilawas, like wala ga paligo, so nagabako na lang permi, or wala naga-enjoy sa mga things na usually gina-enjoy niya before. However, in general, women tend to have better treatment outcomes. Medyo mas malupos i-treat ang babae. Partly also because ang positive symptoms, surprisingly, once malapatan mo sang bulong, are easier to manage. Medyo may bulong, kaya nga pretty clear to deal with the positive symptoms. You have antipsychotic medication. Whereas, ang negative symptoms mo, di ba, these are ang mga wala kagana sa kung ano-ano nga bagay. So, ina is while may araman bulong to help you deal with that, a lot of it is psychosocial. So, parang how do you shape ang environment ng person para maka-interact siya with other people, para magkaroon siya liwat ng interest in doing activities na gina-enjoy niya before. Diba? So, muna ang isa ka concern. Another one is that, diba, women are more open to expressing ang ilayang desire for treatment versus men. Ang mga men niya kung kaisa, hindi na sila magpalapit for treatment. Diba? It's like mga bulig. Diba? They try to deal with it on their own. No? And what's important to note is that the World Health Organization considers it as one of the top 10 forms of disability nga also very expensive to treat, no? Because it is something, especially if it's schizophrenia, it's not something that you treat once and then goes away forever. So there will be episodes throughout a person's life that will show up, no? And also, very high ang rates of suicide attempts for those with schizophrenia. Why do you think that is so? Naman taas ang suicide attempts ng may mga schizophrenia?
Because may distortion gani sila sa reality, ma'am.
Mm-mm. So because may distortion sa reality, what does that mean for the patient? How does that impact ang experience and ang life sang person?
Mabudlay mag-think sa ila sang logic kay iba ila beliefs because gani may delusions sila.
Mm-mm. Diba? So, especially if you have very strong delusions, and yung mga delusions involve thoughts of persecution, diba? You think ko ay kaya apin. You think everyone is out to harm you. Diba? So, parang the world does not feel safe for you anymore. No? So, that's a very important consideration. Ano pa gid ang possible reasons nga man kadamo sang may schizophrenia nga ga-attempt mag-suicide? Peoplets?
Maybe one siguro, ma'am, is ang kaya 'di ba may ano sila, may hallucination. So kasi may nababatian sila nga nagahambal sa ila nga wala sila pulos wala ka bilang, so you have to get yourself out of the equation para mas mahapos sa ila.
Mm-mm. Yeah, so it's also very common. Very common gid for hallucinations, especially auditory hallucinations, to be also persecutory. So very often negative dason ang nababatian. Talagsa ka lang na makabati case nga nanamian sila sang ila gina-hallucinate. Kaya like somebody's telling me, gwapa-gwapa, ginakon niya or something. It's usually negative ang ginahambal sa auditory hallucination. Okay, so that can also push them to the edge, no? Especially pag grabe, naging persistent ang hallucinations. What else? Ano pa gid ang possible nga reasons why very common ang attempts at suicide for people with schizophrenia? In terms of like their relationship with their families and the people in their community.
Maliban, di ba ma'am, sa external support,
Ano, Bri?
ang nabalay lamang nga nagayang panahon siya naman. Limited lang ilab lamang nga support system or external support nila. And pwede man
Okay.
mang makonsider nga ang financial is
Okay.
because di ba ma'am, ang mga meds nila nga ginatake
Okay.
tama pa mahal.
Okay. So yeah, so one is that 'di ba if you've seen sa mga like Jessica Soho or other nga mga documentaries on TV, you have people who are most likely experiencing mga psychotic nga mga episodes. And then anong nakikita ko sa mga ginakulong sila or ginahigot sila, ginaposa sila or gina-chain sila sang ilang mga paryente because the relatives don't know how to deal with it. No, they don't know how to handle it. And then so muna usually ang imo mga friends before nga you would expect to be there don't know how to communicate with you anymore, may not want to, may be afraid of you. So, ang support system definitely diminishes. Not just ang mga friends mo, pero also even your family, especially if they can't accept na may ara kasang mo ng kondisyon or they misinterpret what it means. So, some people will think na gin-possess ang demonyo, ang somebody with schizophrenia. So, syempre, wala dason, di ba? You lose ang imong sense of connection which you need more than ever because of your schizophrenia. Okay? So yeah, so that's also a major factor. And then of course, especially if you are poor, if you don't have enough resources, then ang imo nga medication which you need to maintain tani and manage imo symptoms medyo mabulubudlay. And then like even if you're let's say baklan kadabi bulong, sometimes people will feel like pabigat sila kay ina nga bulong tani pwede pagamiton for basic nga needs of the family and yet kinanglan gamiton for their medication. So sometimes they just opt out of the equation hambal ganin ni Jeka para wala na sang hassle for other people. No, so that's it. Ano pa gid? Anyone else who'd like to share why is it nga super taas ang suicide attempt rate in schizophrenia? In terms of stigma, social stigma, social stigma, anyone?
Problems kurang reasons.
Problems nga?
Siguro mga hard to open up. Alam mo, like, in this nga takbuhan nila la family, they tend to keep it secret as well. Kay feeling nila no one will understand them.
Because especially because muna, schizophrenia is one of the hardest to make sense of nga psychological disorders. 'Di ba? Like that's why it's very common inang 'di ba when you see them walking along like may mga videos of people there is a Rojas bala, 'di ba? You have people around here nga may ara sang psychotic disorder roaming around the streets. And then ano kung isang ginahimo isang mga tao ginavideohan nila and then i-post so and then masig patawa dason ang mga tao or sometimes may ara na I think somebody nga nabatian ko nga do I think do baw gabusong naman niya si Muni. So sometimes ang ginahimo sila is like gina-rape, sila, gina-abuse sila sexually because tibuang man ina. So people feel like they're entitled to do whatever with the person. No. And then muna, ila family usually because they can't make sense of the condition, they just either abandon them or they can't reach out to people around them. So siya ang isa sa pinaka-stigmatized ng mga disorders in the community. Ang depression ganiya is although medyo damo paghihapon sang mapintas sa may depression, there are a lot more people who have empathy and sympathy for people with depression than for people with schizophrenia. So that can be very hard on the patients and the clients. No? So we have to remember that. So we have to also recognize that it's not all the time nga ang schizophrenia sang somebody is active. No? So hindi na siya, it's not gonna be all the time nga may ara siya hallucinations or ga-manifest iya delusions. Usually there are phases. So ang prodromal phase is ang nag-aamat-amat palang build up ang symptoms in males usually occurs during adolescence. No? So nagkakaroon siya sang depression, starts out with depression, anxiety, nag-change ang mood, tingala ka na lang man. And then, biglang nagkakaroon sang angry outbursts. So, usually, it's when nag-uumpisa na nga may nababatian sila or may mga beliefs na sila that are very confusing for them. So, sometimes what they do, because of the social stigma and they don't think they can be understood, they don't think it's safe to tell other people. So what they do is they withdraw. So dire na dason gato nga waay na sila gaistorya sa mga people, but they're doing strange behaviors like tingala ka nga man gapatay siya suga permi because pag masana gali may nakikita siya nga somebody, so patyon niya lang suga para wala siya sa makita. Tama na. Or let's say gasulat siya sang mga kung ano-ano ginapilit niya sa wall because feeling niya that's a form of protection against evil spirits, for example. So may mga muna na. Or they become quite violent sometimes, no, because they hear people saying patyon taka. So abi nila dason there's actually a person intending to harm them. So gaamat-amat. So wala pa sila ga-express sang kung anong gina-hallucinate or gina-delusion nila. But usually ang mga behaviors nga daw medyo weird, gaumpisa na sila withdraw from people. So that's the prodromal phase. And then the active phase or the acute stage, that's when obvious na they are psychotic. They have the psychotic condition. And it may last for weeks. On average, 6 weeks. So it can be a bit longer, it can be a bit shorter. And then eventually, nagadula ang psychotic na episode. So ang mga positive symptoms nadudula, and usually ang nabibilin are the negative symptoms. And then eventually there may come a time where nagabalik dason ang active nga level. So gatungan na naman ng positive symptoms, especially if hindi siya ma-manage by medication. No? So ang positive symptoms. If you look at the explanation of what schizophrenia is and other disorders, it's really a combination of many, many things. We see that in identical twins, there is a 48% concordance rate. So the likelihood that one twin is going to develop schizophrenia is very high, almost half, versus fraternal twins. Diba? And what does that tell us about schizophrenia? What does it mean pag grabe kataas ang concordance rate ng identical twins? There is almost a 50% chance nga pag ang one twin has it, the other twin will also have it. What does that say about schizophrenia as a genetic condition? Ating, what do you think does that say? Anyone? Goish? Yes, Bri.
Gaan ako magpanyong.
Okay.
Gani ma'am question duwat ma'am, kung ang identical twins naman taas ang ilang ano ma'am no?
Oo. What does it mean kung amo nagali ka taas na almost 50% ang chance mo nga mag-develop ka man schizophrenia if one of your identical twins has it versus fraternal twins na 17% lang.
Hello, ma'am.
Oh, yes, Angie and Ating.
Siguro, ma'am. Hello. Ba't ano
Sige,
po?
sige. Sige. Angie, Danay, and then si Ating.
Ma'am.
Siguro, ma'am, it may affect the self-growth, ma'am, if ang isa may possible nga schizophrenia.
So what does it say about schizophrenia and genetics? Sige, so after Angie, Ating. Ay, okay. Gala, sige. So sige, Bri, Danay. You were gonna say something, Bri. Bri, you were gonna say something.
Wait lang. Identical twins. I think ma'am, di ba ma'am, genetics, may connection between sa genetics nila. And it can be nga ka, if si mother nila or father nila ang ang schizophrenia na ma'am, pwede na siya ma'am na nag-mutate bala ma'am sa gene sa ilang mag-utod.
And not only the mother or the father, no, but basically the whole genetic line sa
Genetic,
inyong
ma'am.
lahi. And usually, amo na, again, when you look at the rates of concordance, diba, there's always going to be a comparison sa identical twins. I remember ang identical twins, the same ang genetic material nila. So meaning ang instructions on how to build their body is identical. Versus fraternal twins, nga may similarity man, pero may aras ang more differences, versus ang hindi twins, nga lain mas less ang similar nga genetic material. So if you see nga ang identical twins ya, taas ang concordance rate for a disorder, that tells you nga medyo heritable ang disease and ang disorder, mas dako ang basis niya sa genetics. Okay, than usual. So the idea is ang imo nga vulnerability to developing schizophrenia is heavily influenced by your biological na aspect. So meaning, kung may stressors ikaw in your environment, remember the diathesis stress model, kung may stressors ka in your environment, and then may ara ka sang genetic vulnerability for schiz, mas dako di hamak imo chance nga mag-develop sang schiz versus somebody nga damo stressors sa environment pero wala sang genetic vulnerability to develop schiz. Diba? That's why some people, grabe naman, basta grabe inagyan ni mo niyang stress sa kabuhi. Waay man siya gani, nag-quote and quote, nagbuang. Diba? Pero si Muni, ginbayaan lang sa sang iyang amiga or amigo, nagbuang dason. May muna nga mga linya ang mga tao. So sometimes people think of it as kay mahina loob sang isa ka person. But we have to recognize there might be a genetic vulnerability in this other person. That's why mas madali siya nag-manifest sang symptoms sang schizophrenia. Okay. Gets nyo ang what it means pag may aras ang information on concordance rate sa genetics? Guys? Can you still hear me?
Yes, ma'am.
Okay.
Ma'am,
Yes, sige. Question so far. Question so far? Ala? Okay lang? Okay. Sige. I'm assuming kung wala sang respond, it's okay lang. I hope. But then again, we don't know which genes specifically, which part, which chromosome specifically. It's a polygenic disorder. So meaning there are multiple genetic instructions across your whole genetic code that may be influencing ang imo vulnerability for schizophrenia. So right now, we don't have that information and scientists are still studying it. So there's a long way to go pa before we can actually do something about that part. The other one that's also an important influence has to do with biochemical abnormalities. And very often, ang most popular nga hypothesis is the dopamine hypothesis. Certain excesses and certain deficits in certain parts of the brain in the supply and release of dopamine. And the other one also has to do with serotonin, which is also heavily involved pag abot sa mood. And so that's also an important consideration. And then the third aspect, it has to do with brain structure abnormalities. We don't know if it's a cause and effect or it just is a relationship, my connection. But those with schizophrenia tend to have enlarged ventricles. So meaning do medyo may gahubag ang ventricles, and these contain your cerebrospinal fluid which helps protect ang imong spinal cord. And then another thing that's common is that those with schizophrenia have smaller temporal and frontal lobes. Ang temporal lobes din gani located dapit. Din gani located ang temporal lobes
sa may ears.
sa may ear, sa ibabaw sa ear dapit. Yes. So temples, 'di ba? So yeah, so smaller ang ila temporal lobe and smaller ang frontal lobe, ang diri sa may agtang dapit. And less ang gray matter of the brain. So in the brain is composed of gray matter and white matter. No, so your gray matter, 'di ba? Can you still remember ang itsura sang neuron? Lang. My matter para may